Number three. Number three is something called adhesive capsulitis, also known as frozen shoulder. This is a very common pathology. We see this primarily in patients that are number one, female, number two, have a history of thyroid problems, either hyper or hypothyroid, or number three, diabetics. And also there's also the fourth category where it just generally can happen idiopathically in anyone. But that being said, adhesive capsulitis occurs when you start off having maybe injured your shoulder just doing some light activity. You may have a little bit of soreness. You go to bed that night, you wake up the next morning, it's a little bit more sore, it becomes a little bit more painful. Gradually that pain gets exceedingly worse over a period of time, and it gets to the point where it hurts to move your shoulder in any direction whatsoever. You cannot move it forward, out to the side, behind your back. All those motions are inhibited, and it gets harder and harder and harder as the pain gets worse and worse and worse. So what happens is that the pain level, if you look at it from a chart standpoint, will start out very, very minimal and get worse, 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 increase, 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 and get to the point where it just plateaus. This is pain on this axis, okay? And as pain goes up, it kind of levels out. The problem is that as the pain goes up, the motion gets worse. And then they lose more and more range of motion. And so once you reach this point where the pain is plateaued and it's not as bad, the motion is pretty much, it's less, and it's basically where it's at. And unfortunately for most of those people, if they haven't been diagnosed early enough, they basically have a frozen shoulder with very limited mobility and motion. And they have some limited options, including extensive physical therapy or even a surgical capsular release and manipulation under anesthesia, where we can actually get their motion back. So the issue is trying to make the diagnosis early and preventing them from getting them to that frozen shoulder phase. What frozen shoulder is, it's almost like a perfect storm in the shoulder per se. What happens is you develop a little bit of bursitis in this space here, which is the subacromial space. You start protecting the shoulder, start not moving it as much, and the soft tissues in the shoulder, which is the synovium and the capsule surrounds this whole ball and socket. It's underneath the tendon, starts to tighten up all the way around here, okay? If you look at on the top view down, looking at the ball and the socket here, this inflammation gets worse, and then everything starts to kind of shrink and contract, and that's what creates the frozen shoulder. So it's key to make that diagnosis early so you can get the mobility and keep your mobility. There are some treatment options using cortisone shots or even oral steroids, but that's usually going to be managed by your physician, in addition to doing aggressive physical therapy and home therapy. So the key with this pathology is making sure you get the diagnosis early so you can implement a treatment program and prevent yourself from going down towards a frozen shoulder.